Hello, my name is Gretchen Schneider. I'm a nursing student at Jacksonville State University in the class NU 7112, and my DNP-led interdisciplinary community-based program is about children with type 2 diabetes. The pathophysiology of type 2 diabetes mellitus is caused by a combination of defective insulin secretion by pancreatic B cells and the inability of insulin-sensitive tissues to respond appropriately to insulin. With the progression of the disease, insulin secretion becomes unable to maintain glucose homeostasis, causing hyperglycemia. A higher percentage of adipose tissue or body fat promotes insulin resistance. With sedentary lifestyles, high caloric diets, and aging population, type 2 diabetes is on the rise. Of all the people with diabetes mellitus, type 2 diabetes encompasses 90 to 95%. Type 2 diabetics are sometimes called non-insulin dependent diabetes or adult onset diabetes. Type 2 diabetes can go undiagnosed for a long time because of the blood sugar gradually getting higher, and patients do not notice the classic diabetes symptoms. And you can see the classic diabetes symptoms here, such as increased thirst or dark areas of the skin and skin folds. More than 34 million Americans have diabetes, which is about 1 in 10. Type 2 diabetes most often develops in people over age 45, but more and more children, teens, and young adults are also developing it. The daily life of a child with type 2 diabetes. Children will have to check their blood sugar using either a finger stick 4 or more times a day or a continuous glucose monitor because they have to check their blood sugar before every meal if they feel like their blood sugar could be high or low, and occasionally in the middle of the night. Children are either counting carbohydrates to see how much insulin to give, using a set dose of insulin with meals, or using a sliding scale or a correction factor to know how much insulin to give. Children need to be making sure they do not eat a lot of carbohydrates or sugar because that could increase their blood sugar. Children have the responsibility to carry an insulin pump, a continuous glucose monitor, a meter, lancets, and different insulins everywhere they go. While it's a lot of responsibility on the parent, this can be very overwhelming for children and their parents. What could increase your risk for developing type 2 diabetes? Having extra weight and lack of physical exercise. And type 2 diabetes occurs more frequently in women with prior gestational diabetes mellitus, but men are more likely to have diabetes also. If you're an African American, a Native American, Hispanic, Latino, or an Asian American, you also have a higher risk of developing type 2 diabetes. The older a person becomes, the higher chance they have of developing diabetes. The American Diabetes Association has this risk test that helps people calculate their risk for type 2 diabetes. While the age range starts at 40 years old, this is still a great tool to use to see your risk for type 2 diabetes. A female child 10 years old with a mother who has a history of diabetes. The female child has high blood pressure, is not physically active, is 4'10" and weighs 150 pounds, has a risk score of 5. This correlates to having a high risk for type 2 diabetes. Get Out of Your Seat is a DNP-led interdisciplinary community-based program that aims to help prevent type 2 diabetes in children. This program will go to different elementary schools in the Jefferson County area of Alabama to give information to children about how they can decrease their risk for type 2 diabetes. Get Out of Your Seat, SEEAT. Type 2 diabetes has steadily increased in children. While some risk factors are non-modifiable, such as age and family history, there are some risk factors that a child can work on and change, such as increasing their water intake, eating a healthier diet, and adding exercise to their daily routine. SEAT, SEEAT, S stands for swallow some water. E, eat healthy. E, exercise. A, ask your family if they have a history of diabetes. And T, take your weight. All these risk factors are either modifiable or non-modifiable. Swallow some water. Water is a good drink to keep you hydrated while also having 0 calories. Fewer sugary drinks needs to be consumed by a person who has a risk for developing type 2 diabetes. A survey was done. It was a study that was done to show that water intake was inversely related to new onset hyperglycemia. When a person drank less water, they had a higher chance of developing hyperglycemia. Eat healthy. The American Diabetes Association recommends to eat a meal similar to this image of a plate. Half the plate should be non-starchy vegetables such as green beans, celery, and squash. A quarter of the plate should be carbohydrate foods such as potatoes or bread. And proteins such as edamame, tofu, tuna, or even chicken should take up another quarter of the plate. You can also see a cup of water, and we want to drink water because it has 0 calories. Exercise. The American Diabetes Association recommends exercising 150 minutes weekly. That sounds scary at first, but that's really only 2.5 hours per week, and if you divide that up by 5 days, it's only 30 minutes a day. Instead of thinking about physical activity as a chore, make it something you look forward to, whether it be walking outside with friends, playing outdoor games such as Red Rover, or dancing around to music alone in your home. These are great ways to get some exercise while having fun. Instead of sitting around at home all afternoon watching TV, get up occasionally to check the mailbox, walk the dog, or even go to the kitchen to eat a healthy snack. The American Diabetes Association strongly recommends against sitting around for long periods of time. Ask your family. Having a family history of type 2 diabetes can increase your risk for developing type 2 diabetes. A large-scale genome-wide association study was done, and it showed that 75 type 2 diabetes associated genetic variants have been identified. Type 2 diabetes has been shown to run in families. Knowing if your family has a history of type 2 diabetes is a great way to see a person's risk for developing type 2 diabetes. This is a great chart to see, if you don't have a BMI calculator, how your height and weight correlate to being underweight, normal, overweight, or obese. If you're 5'3" and around 121 pounds, you are in the normal range. But if you're 5'7" and around 187 pounds, you are in the overweight range. Get Out of Your Seat is a DNP interdisciplinary prevention program to help children understand their risk for type 2 diabetes. We will go to different schools in the Jefferson County area of Alabama and speak to the children about their risk factors and what they can change and work on. After the presentation about Get Out of Your Seat, we will have a post-test to see what is learned by the children. A DNP, a nutritionist, and a physical educational teacher will be used in the program. The DNP will be the main presenter who will explain type 2 diabetes, the risk factors, and how to change your risk factors. They will give an informative lecture to include the components of SEEAT: swallow some water, eat healthy, exercise, ask your family if they have diabetes, and check your weight. Asking children to privately calculate their risk in their head is an important part of this project. If children are aware of their risk, they can mention it to their parents or primary care provider. The physical educational teacher will then go up and demonstrate a fun game that requires some mild to moderate exercise. Could be Red Rover or a relay race. Involving friends and having fun is important to show that exercise is not just going to the gym or running around the track. The nutritionist will have a fun snack cooking demonstration. The snack could be yogurt with fruit or a smoothie. Making sure that the meal tastes good but is also very healthy is key. Pre- and post-test questionnaires will be given before and after the presentation to the children. This will help the DNP leaders evaluate to see if the presentation was informative for the children who listened and participated. The information obtained will then be used to make adjustments to the presentation in future presentations. Once someone's diagnosed with type 2 diabetes, regular doctor visits, recommended lab work every 3 months by the American Academy of Pediatrics, and letting an endocrinologist assess your blood sugars and adjust your insulin is secondary prevention ways of preventing type 2 diabetes mellitus. Tertiary prevention for type 2 diabetes could be family and child life counselors, nutritionists, or even insulin pumps or continuous glucose monitors. Having someone to talk to about what you're going through, having a nutritionist give you healthy meal ideas, and wearing an insulin pump or a continuous glucose monitor can help managing your diabetes easier. Collaborating and quality of practice are two great leadership competencies needed for DNP nurses. Conclusion. References.